Shocking foods that feed cancer cells. Dr. Barbara O'Neill, a well-known health educator and naturopath, advocates for natural remedies and holistic approaches to health, including cancer prevention and treatment. According to her teachings, diet plays a crucial role in fighting cancer, and she emphasizes whole, plant-based, and nutrient-dense foods to support the body's healing process. Cancer is a complex disease. There are many different types of cancers, as well as many potential causes. Although we still don't know all the answers, what is known is that a variety of factors can contribute to the development of cancer. Genetic makeup and family history play a role. But external factors that you may have control over, like your lifestyle habits, have an even bigger impact. In fact, research shows that 80 to 90% of malignant tumors are related to external factors. One of the most important lifestyle factors to consider is your diet. That's because a large body of research has shown that some foods are associated with a higher risk of certain types of cancer. In this video, we'll take a closer look at specific foods and beverages that may increase your risk of cancer, and what the scientific evidence has to say about the link between these foods and the risk of cancer. Best foods that may help lower your risk of cancer. Broccoli. Broccoli contains sulforaphane, a plant compound that's found in cruciferous vegetables and may have potent anti-cancer properties. One test tube study in 2010 showed that sulforaphane reduced the size and number of breast cancer cells by up to 75%. Similarly, a 2004 animal study found that treating mice with sulforaphane helped kill off prostate cancer cells and reduced tumor volume by more than 50%. Some studies have also found that a greater intake of cruciferous vegetables such as broccoli may be linked to a lower risk of colorectal cancer. Eating more cruciferous vegetables was associated with a lower risk of colorectal and colon cancer. Including broccoli in a few meals per week may come with some cancer-fighting benefits. But keep in mind that the available research hasn't looked directly at how broccoli may affect cancer in humans. Instead, it has been limited to test tube, animal, and observational studies that either investigated the effects of cruciferous vegetables or the effects of a specific compound in broccoli. Thus, more studies are needed. Carrots. Several studies have found that eating more carrots is linked to a decreased risk of certain types of cancer. For example, the authors of a 2015 analysis looked at the results of 5 studies and concluded that eating carrots may reduce the risk of stomach cancer by up to 26%. Another research review found that a higher intake of carrots was associated with 18% lower odds of developing prostate cancer. The diets of 1,266 participants with and without lung cancer. They found that current smokers who did not eat carrots were 3 times as likely to develop lung cancer as those who ate carrots more than once per week. You can try incorporating carrots into your diet as a healthy snack or delicious side dish just a few times per week to increase your intake and potentially reduce your risk of cancer. But remember that while these studies show an association between carrot consumption and cancer, they don't account for other factors that may play a role. Beans. Beans are high in fiber, which some studies have found may help protect against colorectal cancer. A history of colorectal tumors and found that those who consumed more cooked dried beans tended to have a decreased risk of tumor recurrence. Beans or navy beans to rats and then inducing colon cancer blocked the development of cancer cells by up to 75%. These results suggest that eating a few servings of beans each week may increase your fiber intake and help lower your risk of developing cancer. However, the current research is limited to animal studies and studies that show association but not causation. More studies are needed to examine this association in humans, specifically. Berries. Berries are high in anthocyanins, which are plant pigments with antioxidant properties that may be associated with a reduced risk of cancer. In one small study, after 25 people with colorectal cancer were treated with bilberry extract for 7 days, the growth of cancer cells decreased by 7%. Freeze-dried black raspberry powder helped decrease levels of certain markers associated with cancer progression in people with oral cancer. In a 2001 animal study, researchers found that giving freeze-dried black raspberries to rats reduced the incidence of esophageal tumors by up to 54% and decreased the number of tumors by up to 62%. A berry extract could inhibit several biomarkers of cancer in rats. Based on these findings, including a serving or 2 of berries in your diet each day may help reduce the development of cancer. But keep in mind that these are animal and observational studies looking at the effects of a concentrated dose of berry extract rather than whole berries, and more human research is needed. Cinnamon. Cinnamon is well known for its health benefits, including its ability to lower blood sugar and ease inflammation. In addition, some test tube and animal studies have found that cinnamon may help block the spread of cancer cells. Cinnamon extract decreased the spread of cancer cells and induced their death. Another test tube study showed that cinnamon essential oil suppressed the growth of head and neck cancer cells and significantly reduced tumor size. Including 1/2 to 1 teaspoon, TSP, or 2 to 4 grams, g, of cinnamon in your diet each day may be beneficial in cancer prevention and may also have other benefits, such as lowering blood sugar and decreasing inflammation. However, more studies are needed to understand how cinnamon may affect cancer development in humans. Nuts. Research has found that eating nuts may be linked to a lower risk of certain types of cancer. The diets of 19,386 people and found that eating a greater amount of nuts was associated with a decreased risk of dying from cancer. Eating nuts regularly was associated with a decreased risk of colorectal, pancreatic, and endometrial cancers. Other studies have found that specific types of nuts may be linked to a lower cancer risk. For example, Brazil nuts are high in selenium, which may help protect against lung cancer in people with low selenium levels. Feeding walnuts to mice decreased the growth rate of breast cancer cells by 80% and reduced the number of tumors by 60%. These results suggest that adding a serving of nuts to your diet each day may reduce your risk of developing cancer in the future. Still, more studies in humans are needed to determine whether nuts are responsible for this association or whether other factors are involved. Olive oil. Olive oil is loaded with health benefits, so it's no wonder it's one of the staples of the Mediterranean diet. Several studies have even found that a higher intake of olive oil may help protect against cancer. Consumed the most olive oil had a lower risk of developing breast cancer and digestive system cancers than those who consumed the least. Cancer rates in 28 countries worldwide and found that areas with a higher intake of olive oil had lower rates of colorectal cancer. Replacing other oils in your diet with olive oil is a simple way to take advantage of its health benefits. You can drizzle it over salads and cooked vegetables or try using it in marinades for meat, fish, or poultry. Though these studies suggest that there may be an association between olive oil intake and cancer, other factors are likely involved as well. More studies are needed to examine the direct effects of olive oil on cancer in humans. Turmeric. Turmeric is a spice well known for its health-promoting properties. Curcumin, its active ingredient, is a chemical that has anti-inflammatory, antioxidant, and even anti-cancer effects. Researchers examined the effects of curcumin in 44 people with colon lesions that could have become cancerous. Among participants who consumed 4 g of curcumin daily for 30 days, the number of lesions decreased by 40%. Curcumin was also found to decrease the spread of colon cancer cells by targeting a specific enzyme related to cancer growth. Other test tube studies have found curcumin to be effective in slowing the growth of lung, breast, and prostate cancer cells. For the best results, aim to consume 1/2 to 3 teaspoons, 1 to 3 g, of ground turmeric per day. You can use the ground spice to add flavor to foods. Pairing it with black pepper helps boost its absorption. Citrus fruits. Eating citrus fruits such as lemons, limes, grapefruits, and oranges has been associated with a lower risk of cancer. Participants who had high intake of citrus fruits had a lower risk of developing digestive and upper respiratory tract cancers. A greater intake of citrus fruits was linked to a reduced risk of pancreatic cancer. That a high intake of citrus fruit, at least 3 servings per week, reduced the risk of stomach cancer by 28%. These studies suggest that including a few servings of citrus fruits in your diet each week may lower your risk of developing certain types of cancer. But keep in mind that these studies don't account for other factors that may be involved. More studies are needed on how citrus fruits specifically affect cancer development. Flaxseed. High in fiber and heart-healthy fats, flaxseed can be a nutritious addition to your diet. Some research has shown that it may even help decrease cancer growth and kill off cancer cells. Breast cancer received either a flaxseed muffin daily or a placebo for more than a month. At the end of the study, the flaxseed group had decreased levels of specific markers of tumor growth, as well as an increase in cancer cell death.